In our pulmonary clinic, we do see a lot of smokers, and we determine if they are eligible for low-dose CT scans for lung cancer screening. Current eligibility criteria is patients more than 55 to 77 years old, and those who smoke more than 30 pack years, and those who are still currently smoking or quit within last 15 years. So you meet the criteria for the lung cancer screening, and the low-dose CT scan shows any suspicious nodules. Depending on the size of the nodule, we'll either follow the nodule, or if it is big enough, then we'll plan to do bronchoscopy guided biopsy, especially with the Veran endobronchial navigational bronchoscopy. It is easy to identify the lesions and then get tissue samples as soon as possible and get to the diagnosis sooner. So that we can coordinate with oncology and get you appointments as soon as possible and start you on treatments within few weeks of diagnosis. Varene is a navigational bronchoscopy system which helps us to identify remote lung lesions and get biopsies.
So if we were to try and sample a nodule without taking into consideration that the nodule is actually moving when the patient is breathing, we may end up sampling the wrong area, not get the diagnosis, or even worse, we can hurt the patient. So with this new navigational technique, we can identify where the nodule is going to be when the patient is exhaling, or where the nodule is going to be when the patient is inhaling, based on this special technology, and then modify the procedure and sample the right area based on those scans.
This actually is a kind of minimally invasive procedure. It's a one-day procedure, and they can be discharged after the procedure.
Most of the patients with lung cancer are actually diagnosed in stage 3 or 4, which means their survival is going to be significantly lower than a patient if they were to be diagnosed at stage 1 or stage 2. With the new technology, there are several things that we can do. Number one, with the low-dose CT scan for lung cancer screening, we are likely to identify patients with earlier stage lung cancer, or even before it actually starts showing manifestation of lung cancers. With the new navigational technology, which has improved tremendously over the past 5 to 8 years, we can not only identify and sample very peripheral lung nodules, but at the same time, we can do a complete staging workup with the lymph node station sampling, which would give the patient not only a diagnosis of lung cancer if they have it, at the same time we'll know the stage of the lung cancer and start treatment as soon as possible.